Hello, pet lovers. Welcome to our channel. Today, we will address a crucial topic: how does the dog get distemper? Before we get started, don't forget to leave your like, subscribe to the channel and enable notifications so you don't miss any valuable content. Who here doesn't love their furry? I know we all have an unconditional love for our pets, which is why understanding how distemper can affect our four-legged friends is essential. Prepare for an emotional journey. Before we get into the details, it's crucial to understand why we should be aware of distemper. This viral disease can be devastating for dogs, and our goal is to ensure that you have the information you need to protect your best friend. What is the distemper? Distemper is a highly contagious disease that affects dogs, caused by the CDV virus, canine distemper virus, or canine distemper virus, VCC. This virus belongs to the family Paramyxoviridae and is known to cause a number of severe and potentially fatal symptoms in animals. Origins. The origin of distemper is related to the CDV virus, which is transmitted mainly by air, through particles expelled by sneezing, coughing or ocular and nasal secretions of sick dogs. Places with a high concentration of animals, such as shelters and kennels, facilitate the spread of the virus. Symptoms. Early symptoms of distemper include fever, vomiting, and diarrhea, often accompanied by thick yellow discharge in the eyes and nose. As the disease progresses, other signs may appear, such as lack of appetite, cough, and, in advanced stages, seizures and neurological problems. It is essential to be aware of the symptoms and seek veterinary assistance immediately for proper diagnosis and treatment. Prevention through vaccination is the most effective way to protect dogs against this serious disease. How do dogs contract distemper? The transmission of distemper in dogs occurs mainly by direct or indirect contact with animals contaminated by CDV virus, canine distemper virus. The transmission routes are diverse and include: 1. Direct contact. Transmission can occur through close contact between infected and healthy dogs. This includes licking, sneezing, and sharing objects such as food bowls and toys. 2. Indirect contact. Contaminated surfaces and objects can serve as vehicles for the virus. If a healthy dog comes into contact with areas where an infected animal has been, there is a risk of contamination. This highlights the importance of sanitizing environments and objects often touched by pets. 3. Airways. The distemper virus is transmitted through the air, mainly by aerosols and infectious droplets from excretions and body secretions of infected dogs. This means that environments with agglomeration of animals are conducive to the spread of the virus. 4. Transplacental transmission. In some cases, transmission can occur from mother to calf during pregnancy, when the virus is transmitted through the placenta. This type of transmission highlights the importance of care during reproduction and proper veterinary monitoring. It is essential to adopt preventive measures, such as vaccination, and maintain clean environments to avoid the spread of distemper among dogs. The treatment of canine distemper aims to relieve symptoms and provide support to the animal's immune system. It is worth mentioning that there is no specific cure for distemper, and treatment varies according to the severity of symptoms. Treatment and care options include: 1. Nutritional support. Provide a balanced and easily digestible diet to ensure that the dog receives the nutrients needed to strengthen his immune system. 2. Hydration. Keep the animal well hydrated, especially if there are symptoms of vomiting or diarrhea, which can lead to dehydration. 3. Symptomatic medications. Some medications may be prescribed to control specific symptoms, such as antipyretics for fever, antiemetics for vomiting, and antidiarrhea for diarrhea. 4. Antibiotics. In cases of secondary infections, the veterinarian may prescribe antibiotics to prevent or treat bacterial infections. 5. Hospital care. In more severe situations, it may be necessary to hospitalize the dog for constant monitoring and intensive care administration. 6. Physical therapy. In some cases, physical therapy may be recommended to aid recovery, especially if there is neurological impairment. 7. Prevention of. Vaccination is the best way to prevent distemper. Be sure to keep your pet's vaccination schedule up to date. Remember that treatment should be supervised by a veterinarian, and the animal's response to treatment may vary. Early diagnosis and appropriate intervention are essential to increase the chances of recovery. Now, I want to hear your stories. Have you ever faced illness with your pets? Share in the comments and, of course, suggest which theme you would like to see here on the channel. Prevention and vaccination. The prevention of distemper in dogs is essential to protect these animals against this serious viral disease. Here are some important measures, with an emphasis on vaccination, to ensure the safety of your dog. 1. Annual vaccination. Vaccination is the most effective way to prevent distemper. The distemper vaccine is included in the vaccine packages V8, V10, and V11, and is essential for all dogs. It is recommended to follow the annual vaccination schedule to keep immunization up to date. 2. Puppy stage immunization. It is crucial to start immunization at the puppy stage. The multiple vaccine, given in the first months of life, provides protection against distemper and other diseases. 3. Awareness of contagion. Be aware of forms of contagion, such as contact with secretions, urine, and infected feces. Avoid exposure of your dog to suspicious environments. 4. Maintenance of general health. In addition to vaccination, maintain the overall health of your dog. Provide a balanced diet, regular exercise, and periodic veterinary care to strengthen the immune system. Impact on puppies and elderly. Distemper significantly affects puppies and elderly dogs, and these groups are more vulnerable to the impacts of this viral disease. Here are some specific aspects of the impact on puppies and the elderly. 1. Puppies, 3 to 6 months. Distemper is most common in puppies aged 3 to 6 months. At this stage, the immune response may not be as effective, making puppies more susceptible to infection. The occurrence is often related to loss of passive immunity, occurring after weaning, between 12 to 16 weeks of life. 2. Elderly dogs. Elderly dogs also face significant risks. Immunity can decrease with age, making them more prone to complications from distemper. Non-suppurative encephalitis, a complication of distemper, has been described in elderly dogs, showing the severity of the disease in this group. Therefore, special attention to these groups is crucial for the effective prevention and treatment of distemper. Distemper, despite its mortality rates, has inspiring stories of dogs that have beaten disease. Here are some remarkable narratives. 1. Nelson, patient of the Pompeii Veterinary Hospital. The mortality of distemper can reach up to 80%, but the story of Nelson, a patient at the Pompeii Veterinary Hospital, highlights that it is possible to beat it with proper care. 2. Dog sausage. An exciting story of overcoming. Dog Shaggy won the distemper, demonstrating that with the right care it is possible to overcome the challenges imposed by this disease. 3. Dory, distemper survivor. Dory is an example of survival to distemper. His report highlights the importance of dealing with the sequelae of the disease after successful treatment. 4. Puff, prognosis reversal. Puff, sentenced to euthanasia after contracting distemper, reversed his prognosis with the love and care of dedicated people. 5. Benedict, inspiration for overcoming. Benedict, rescued on a rural road, faces distemper and becomes an inspiration for overcoming, melting hearts with his touching history. These narratives reinforce the importance of veterinary care, love and dedication in the recovery journey of dogs affected by distemper. Did you know that distemper, a serious canine disease, can be confused with other conditions? Stay until the end to figure out how to distinguish symptoms and act quickly. By observing signs such as fever, nasal discharge, cough, and neurological problems in dogs, distemper can be confused with other diseases such as ehrlichiosis and even parvovirus. This similarity in symptoms makes a veterinary evaluation crucial for an accurate diagnosis. The differential diagnosis between rabies and distemper is also essential, especially in epidemic areas of canine rabies, where accurate diagnosis is of particular importance. Therefore, when noticing symptoms in your pet, consult a veterinarian to ensure an accurate diagnosis and start proper treatment. The speed of identification makes all the difference in the prognosis and recovery of the animal. If you love learning about pet care, don't forget to check out our channel, Pet for Tips. There, we have even more valuable tips to ensure the health and happiness of your furry companions. I hope this video is informative and useful for all of you. Don't forget to share it with other animal lovers. See you next time.